Hey everybody, welcome. We're so glad that you're here. Make sure that you get enough to eat and you can come back and get seconds. For those of you who didn't know, we do have an area for the kids to be in during the talk. We have Katie Critelli here from Trumbull County Board of Mental Health and Recovery. And she's going to be talking about some mental health, so if you would prefer for your children to not hear that conversation, you can certainly go up to a child room, but it's going to be an uplifting conversation and educational, so just want to let you know that. Also, just keep your eyes open for the next things that we're doing, follow us on social media, because we've got a lot of things coming up. So enjoy, thank you again for coming, and I'm going to invite Katie to talk now.
Thank you. All right. Good morning, everyone. I am Katie Critelli. I'm from the Trumbull County Mental Health and Recovery Board and also the Trumbull County Suicide Prevention Coalition. I'm going to ask questions throughout, so if you're comfortable raising your hand, please do. If you're not, that's okay too. Keep in mind, if you do decide to self-disclose, which means share with the group, that we are being recorded, so please be cautious of that. I will be available afterwards if you have any questions. So I want to start with, how many of you, by raise of hands, are familiar with the Trumbull County Mental Health and Recovery Board? The Trumbull County Mental Health and Recovery Board. Okay. How many of you know what we actually do? Awesome. So if you're not familiar, for those of you who have not had to reach out to us before, we don't actually provide any services at the board, but what we do is we help get individuals linked to resources, and we provide funding to different agencies in the community so that they can provide the services to anybody that's in need of mental health and substance abuse treatment. Now, as we start to talk about mental health, I want to talk about it in a different perspective, the same way we would talk about going to the gym to care for our body and going to the family doctor or maybe a specialist to also care for our medical health. And so when we talk about mental health, we're talking about our brain health. And at times when we talk about mental health, there can be a stigma that something's wrong with us if we need treatment. But if somebody were to go to the gym to work out, or if you have a cold, or maybe you're diabetic and you have to go to the doctor, no one's going to question that. So why are we questioning when individuals go for mental health or substance abuse treatment? People are nosy. Okay, what else? So going back to that stigma, thinking you're crazy, yeah.
I've been dealing with it for over 20 years.
Okay, what was that? Face their own problems. Okay, great, yeah. So part of how we can help make that change is being more open about talking about mental health and substance abuse and encouraging others to seek treatment and not looking at it as something is wrong with us or something is wrong with somebody else, but looking at it as it's a form of support. It's a way to reach out, to get help, to take care of yourself, and to take care of your overall mental well-being. I know Dr. Clecott talked in the past and had asked what's the difference between a counseling session and venting to a friend? And so does anybody know the difference between a counseling session and venting to a friend?
Yeah, because you can tell them anything you want them to know, and you don't want to tell your friends all that you don't want them to know.
Okay, so you can tell your therapist more. What else?
I'm sorry.
Uh-huh. Okay. Yeah.
Honey, you have to tell them what you want them to know, not what they want to know.
And absolutely. So with a therapist, it's confidential. When we vent to a friend, it's not always confidential. Now, there is some gray area there when we talk about it being confidential, because if somebody's at risk of harming themselves or somebody else, or their symptoms are really starting to impact their life, then a therapist does have to disclose out of the safety of their client and out of the safety of the community. Yeah. What was that?
His symptoms are starting to get a little worse, and we're afraid to tell anybody.
Why are you?
And they tell him what we say, and then he doesn't want to tell us anything.
Okay. So that's
He
a,
is under probate right now from the judge.
okay, for outpatient commitment. So let's talk after, so then I can maybe better understand that case and be able to guide you some.
I know how you feel. I've got two of them. Yeah, I have two, but my other son's stable.
Okay, so yeah, that'll be great for us to follow up after.
My 34-year-old, they grow out of this hyper and assembly, still hyper. I think a lot of my sons are.
Okay, so what are some other differences between venting to a friend and talking to a therapist?
Okay, I'm a good example.
Mhm.
Okay, I'm a licensed beautician.
Okay.
I was working in the shop and everything. Now I only got one hand,
Oh.
so of course that's a mental issue for me.
Yeah.
You know, and this is why I got tired of talking to friends, and I said I need to go and get some professional help.
Mhm.
That's my example.
Yeah. Well, thank you for sharing that. And also, a lot of people view their beautician or their barber as their therapist, their counselor, right? I'm sure people would cut.
I miss being
Yeah.
You just don't know. Yeah, that too.
Yeah, and that's a little different, right? Because again, we go back to confidentiality.
Yeah.
So a therapist can't tell anybody. You're also in a safe space where nobody can hear. There's a sound machine, so nobody can hear outside of the walls. And then the other thing I tend to hear is my therapist won't tell me what to do. That's a big complaint. They won't tell me what to do.
They're not allowed.
Why?
Because it's patient confidentiality.
So
They can give you advice, but they can't tell you what to do.
they can't tell you what to do, but I'm also gonna advice is a little tricky, right? Because when we go to therapy, you are all in the driver's seat. Your therapist is in the passenger seat. You are the one driving in the direction of the way you want your life to go. And a therapist is there to support you. They're not there to give advice. And when we reach out to friends, sometimes we're in a crisis or we're so upset with what's going on, we're looking for someone to tell us, well, what do we do right now? And then we go to a therapist and it's like we're waiting for them to say, well, you need to do this or this. And that's not what they do, but they try to guide and support you and help you come to your own conclusions. And when we come to our own conclusions, then we're able to gain insight into what's happening, maybe change our perspective, maybe gain some additional skills to learn how to cope with our situation, especially if it's a situation we're not ready to change or we can't change. We don't have the resources to make the change at that time. And when we talk about mental health symptoms, what are some mental health symptoms that you all are aware of in general? Okay, and what is anxiety? Can you?
Anxiety is where you're busy.
Okay.
Depression is when you're sad, you're lonely.
Okay.
Got both of them. It sucks.
No, that's okay. It can feel like it sucks at times, for sure.
Depression.
Hallucinations. So I want to go back to anxiety and talking about anxiety. If what's another for someone to say, well, what's it mean to be anxious? Can anyone describe what that feels like? Oh, okay. Heightened state of mind. Oh, feel. Okay. So we would say some irrational thoughts, irrational versus rational thinking. So when you have anxiety, those thoughts can feel really real. Sometimes we talk about like that feeling of butterflies in your stomach, maybe your chest being tight, not knowing what to do. Maybe you're on edge. You can't really calm yourself. Just a overall sense of feeling very uneasy can impact our sleep, our appetite. I know some people get anxious and they can't eat at all. And other people get anxious and then they have an increase in their appetite. Yeah. It can at times, yeah. What, pardon? Okay.
And it's got everything in it. Depression, anxiety, your attitude changes, your mind changes, everything just changes. You know what you're doing sometimes.
Okay, yeah. And how about depression? What do those symptoms look like if someone's depressed?
Get mood swings.
Okay. Oh, go ahead. Can you repeat that? Okay, she said you don't feel like doing anything. What else? You want to be alone?
Start to isolate yourself, hermit inside your house. You don't really want to talk to anybody or anything. You put all of your bills and everything off to the side because you're too depressed to deal with all of it.
Okay, so you isolate. You don't want to deal with what's really happening around you. What were you going to say?
Low self-esteem.
Low self-esteem. Awesome.
Cry. When they really cry.
Yeah, or you may cry and you may not know why, right? Yeah. Constant sadness or hopelessness. Yeah. Oh, what was that? Sleeping. Yes. Increase for sleep. Yeah. Negative thinking. And when individuals are could be drinking, increase in substance use. Yeah. High burnout. Yeah. It could be uncontrollable. Absolutely. And so when someone's depressed or anxious, it's, and they're in bed and they don't want to get out of bed and they're feeling sad, what do people tend to say? I'm okay. Buck up. No, that's,
You
yeah.
know what? A lot of people, like when us women, when we have our babies, we get through it like a depression too.
Postpartum depression, absolutely. And so at times, individuals will tell an individual who is depressed, just get dressed, take a shower, get out of the house, go do this. But when you're feeling those symptoms, they can feel debilitating. Like you truly can't pull yourself out of bed. Almost like when we have the flu. I don't know about you, but if I have the flu, I am in bed, down and out, sleeping. I cannot get out of bed. And so when you're depressed, it can feel the same way. Going into, I believe you had mentioned hopelessness, and we're going to get into more of the severe symptoms of feeling depressed and feeling hopeless, which can lead to an individual feeling like they don't have a purpose to be on this earth, to feel like they don't want to live. And that would be what we call suicidal ideation. And that comes when individuals are feeling sad and hopeless and helpless and feeling like there's nothing that's going to change that current state of pain, because we talked about depression can be very debilitating. And when you're in that moment and it feels like it can't change and you feel like there's no way out, individuals can start to feel like they don't want to live anymore. And so what do we do when we see maybe ourselves starting to feel that way or starting to have some symptoms, or a loved one? How do we handle that? Call for help. Who would you call? Okay, 911 if it was severe, or a doctor. Help hotline, love it. 988. Woo, you guys are good. You guys know all those new resources. What was that? A friend you can trust, yeah. So yeah.
I put on my gospel music.
Oh.
That's my inspiration too.
Yes, you know what? Our connection to the religious community is what we call a protective factor. And when we talk about suicidal ideation, so what is a protective factor? A protective factor is what keeps us here. It could be our religious community. It could be our belief in God. It could be because we have children at home, or we have parents. Maybe we love what we do for work, or we have a really great hobby, and that's what helps keep us here and fulfills us. And when individuals don't have that, who do they call? And you guys had mentioned 211, great resource, and I have some resources over there that I'll go over at the end. 211 is Help Network, and they're not just for mental health. You can call for any resource. They have food pantry. You could call for a list of food pantries. You could call for a list of resources for your children. You could call for resources for if you're having medical issues and you don't know who to call, or maybe you don't have insurance and you're not sure how to get the treatment that you need. You could call Help Network, and they will.
It's hard to get if you don't have medical.
Yeah, it is. And so that's a great point, and I want to speak on that. So if you're a Trumbull County resident and you do not have insurance, The Trumbull County Mental Health and Recovery Board will cover your mental health and substance abuse treatment at no cost. So same for Mahoning County residents. You just have to call the Mahoning County Mental Health Board or the Trumbull County Mental Health Board, and we will help an individual get the treatment they need despite their ability to pay. And so there are resources out there, or maybe there's also a sliding scale for an individual who has income. They'll change the amount that the individual would owe at the time of the appointment. But if there are financial barriers, don't ever let that be a reason to not reach out for yourself or someone else, because there are resources. And the financial piece is the last part we're worried about. We're worried about taking care of the individual in that moment. And so how can we help? Going to 988. 988 is the new National Suicide and Crisis Lifeline. It was released actually in July. It's brand new. If you call 988, it's actually going to reroute you to our 211 help network. So 988 calls, it just reroutes you to 211. So whether you call 211 or 988, you're still getting 211. But 988 is a great number to know. It's almost like it's the mental health equivalent of 911. When we call 911, especially after hours when therapists aren't available, police can show up. And that could be very triggering for some individuals. And that's the purpose.
If they feel you're a danger, they will wait. They will wait.
Yeah, if police feel you're a danger to yourself or someone else, absolutely, they would get you to the hospital. But some individuals are triggered by the police, and that could make their symptoms worse, and it may deter them from reaching out, which is why 988 is available, because it's going to be focused on mental health and not legal. However, again, going back to the disclosure and what we disclose and the importance of keeping you and everybody else safe, if there is a need for concern for 988 to contact police for immediate intervention, they do have to break that confidentiality to keep you safe and to keep the community safe. Individuals will say, oh, I called 988 and they lied. They told me they weren't going to tell anybody. And they told, the police showed up or this happened because I was suicidal and they thought I was going to hurt myself. Those are instances that 988 has to get somebody involved, because keeping somebody alive and well and getting them the treatment they need is our priority in that moment. And so the intention is not to turn our back on you or to not or to break your trust. It's in that moment we need individuals that can help think a little more clearly than we are in that moment, because when we're depressed and we're anxious and we're feeling really low, we don't always see that light at the end of the tunnel. Yeah. Mhm. Mhm.
Really?
So in those situations, there's a third resource I'm going to give you. How many of you are familiar with Coleman Access Center?
I am.
You are? Okay.
I go there.
Oh, okay. Great resource. So Coleman Access, the phone number is 392-1100. I will repeat that, 330-392-1100, or you could call 211 and say, connect me to Coleman Access. Coleman Access provides crisis services in the community. So say you have a loved one who won't seek treatment, they're maybe paranoid, having some hallucinations, or they're really, really depressed and you don't know what to do. If you call Coleman Access, they will come out to the house and it's not a full assessment. It is what we would call a crisis assessment to assess for risk. And so for somebody that's calling the police consistently due to their paranoid thoughts, that's mental health related, right? That's not legal. And so that'd be a great situation to call Coleman Access, let them know what's going on. They would be able to come out and assess and see, does that individual need to go to the hospital? Because we don't want to see someone who's paranoid continuously calling 911, because maybe they think someone's breaking into their house, so they keep calling 911 due to these thoughts, and then they end up going to jail because they need mental health treatment. They don't need legal charges. So thank you for sharing that. So Coleman Access also does walk-in crisis assessments. So if you're in crisis and you're like, I need a counseling appointment today, how many of you know what's an average timeline? If you call and ask to speak with a counselor, say Monday I wake up and I'm like, I need to talk to a counselor, I call Valley or Compass or Coleman, I call any agency, and I'm like, I need to schedule an appointment with a therapist today, but I've never been there. How long are we looking at for a wait to get in?
Well, when I went there, I deal with homeless.
Okay.
So when I moved from Dayton, Ohio, and I came here, and I
Mhm.
said I need staff help, so I went there. It took me all day, but everything was taken care of that same day.
Okay.
I mean, that was just me. I don't know about nobody else.
So you had same day treatment. Awesome. Anybody else know the time frames? A month and a half. How long? 2 weeks. And when we're having symptoms, that feels like forever, right? Going back to like talking about being in bed and with a flu, and it's like you have all these symptoms right now. The doctor can see you in 2 weeks. Oh, same for mental health, right? When we're feeling that way and we're having these symptoms, 2 weeks feels like forever. And so Coleman Access, you will see a therapist if you walk in, if you're in crisis, and they're located downtown, right downtown Warren, down in Courthouse Square. You can walk in for an assessment. Same for if somebody needs a substance abuse treatment, they can walk in for an assessment and they will work on getting that individual into detox treatment. So there are resources out there, and I did bring some resources. Please take what you want. There are 988 cards. So these are the 988 cards there's a QR code you scan with your phone on the back. There's Help Network cards. My business card is there. Feel free to call me if you need anything. I cannot provide treatment, but I can provide you with resources, and I can link you to different providers. For the Trumbull County Suicide Prevention Coalition, these are lip balms. We have notepads and pens. We have a Coping with the Holidays booklet, our board brochure, so lots of different resources. This is our Life is Better With You Here mirror cling. So these go on any mirror. And this is a great reminder to everybody, right? Life is better with you here. So whether it's on your bathroom mirror, your bedroom mirror, whether it's on, you go to a church and you put it on your church mirror, so everybody gets that message. We're trying to get that message out there. So thank you all. I appreciate all of you listening and your feedback and sharing. You guys, I'm pleasantly surprised that I've never had a group that was aware of all the community resources. So I'm really excited. So thank you. If anybody has questions, I would be happy to talk with you. I will be here for a little bit. So thank you all.